Okay, good morning, everyone, and happy Sabbath to you all. I am coming to you today to discuss glaucoma. The month of January is Glaucoma Awareness Month. So we'll have a little discussion about glaucoma. Now, currently, more than 3 million people in the United States have glaucoma. The National Eye Institute projects this number will reach 4.2 million by 2030, a 58% increase. Glaucoma is called the sneak thief of sight. Since there are no symptoms, and once vision is lost, it's permanent. As much as 40% of vision can be lost without the person noticing. Glaucoma is a leading cause of irresistible blindness. Moreover, among Black American and Latino populations, glaucoma is more prevalent. Glaucoma is 6 to 8 times more common in African Americans than Caucasians. Over 3 million Americans and over 60 million people worldwide have glaucoma. Experts estimate that half of them don't know they have it. Combined with our aging population, we can see an epidemic of blindness looming if we don't raise awareness about the importance of regular eye examinations to preserve vision. The World Health Organization estimates that 4.2 million people worldwide are blind due to glaucoma. In the United States, approximately 120,000 are blind from glaucoma, accounting for 9 to 12% of all cases of blindness. Here are some ways you can help raise awareness. Talk to your family and your friends about glaucoma. If you have glaucoma, don't keep it a secret. Let your family and members know. Refer a friend to the website. Request to have free educational booklets sent to you or your friend. Get involved in your community through fundraisers, information sessions, group discussions, inviting expert speakers, and more. Now, what is glaucoma? Glaucoma is a group of eye diseases that gradually steal sight without warning. Although the most common forms primarily affect the middle-aged and the elderly, glaucoma can affect people of all ages. Vision loss is caused by damage to the optic nerve. This nerve acts like an electric cable and with over a million wires. It is responsible for carrying images from the eye to the brain. There are no cure for glaucoma. Yet, however, medication or surgery can slow or prevent vision loss. The appropriate treatment depends upon the type of glaucoma, among other factors. Early detection is vital to stopping the progress of the disease. Let's discuss the types of glaucoma. There are 2 main types of glaucoma: primary open angle glaucoma and angle closure glaucoma. These are marked by an increase of intraocular pressure or pressure inside the eye. When optic nerve damage has occurred despite a normal IOP, this is called normal tension glaucoma. Secondary glaucoma refers to any case in which other diseases causes or contributes to increased eye pressure, resulting in optic nerve damage and vision loss. Glaucoma is the second leading cause of blindness in the world. According to the World Health Organization, the most common form, there are virtually no symptoms. Vision loss begins with peripheral or side vision. So if you have glaucoma, you may not notice anything until significant vision is lost. The best way to protect your sight from glaucoma is to get a comprehensive eye examination. Then, if you have glaucoma, treatment can begin immediately. Glaucoma is a leading cause of blindness among African Americans and among Hispanics in older age groups. The risk of glaucoma is nearly as high as that for African Americans. Also, siblings or persons diagnosed with glaucoma have a significantly increased risk of having glaucoma. Risk factors. Are you at risk for glaucoma? Those at higher risk include people of African, Asian, and Hispanic descent. Other high-risk groups include people over 60, family members of those already diagnosed, diabetes, and people who are severely nearsighted. Regular eye exams are especially important for those at higher risk for glaucoma and may help to prevent unnecessary vision loss. Now, are you at risk for glaucoma? Everyone is at risk for glaucoma. However, certain groups are at higher risk than others. People at high risk for glaucoma should see a doctor now for a complete eye exam, including eye dilation. Your eye doctor will tell you how often to follow up exams based on the results of this eye health screening. The following are groups at higher risk for developing glaucoma: African Americans. After cataracts, glaucoma is the leading cause of blindness among African Americans and people of African descent. Glaucoma is 6 to 8 times more common in African Americans than Caucasians. People over 60. Glaucoma is much more common among older people. You are 6 times more likely to get glaucoma if you are over 60 years old. Family members with glaucoma. The most common type of glaucoma, primary open-angle glaucoma, is hereditary. If members of your immediate family have glaucoma, you are at a much higher risk than the rest of the population. Family history increases risk of glaucoma 4 to 9 times. Hispanics in older age groups. Recent studies indicate that the risk of Hispanic populations is greater than those of predominantly European ancestry, and that the risk increases among Hispanics over age 60. Asians. People of Asian descent appear to be at increased risk for angle closure glaucoma. Angle closure glaucoma accounts for less than 10% of all diagnosed cases of glaucoma. People of Japanese descent are at higher risk for normal tension glaucoma. steroid users. Some evidence links steroid use to glaucoma. In 1997, the study reported in the Journal of American Medical Association demonstrated a 40% increase in the incidence of ocular tension and open angle glaucoma in adults who require approximately 14 to 35 puffs of steroid inhaler to control asthma. This is a very high dose, only required in cases of severe asthma. Eye injury. Injury to the eye may cause secondary open angle glaucoma. This type of glaucoma can occur immediately after the injury or years later. Blunt injury. Blunt injuries that bruise the eye, called blunt trauma, or injuries that penetrate the eye, can damage the eye's drainage system, leading to traumatic glaucoma. The most common cause is sports-related injuries, such as baseball or boxing. Other risk factors. Other possible risk factors include high myopia, which is nearsightedness, hypertension, and central cornea thickness, less than 0.5 milligrams. Now, we've heard all we need to hear at this time about glaucoma. You've heard the signs and symptoms, you've heard the risk factors, and you heard the types of glaucoma that you can have. Now, let me tell you my personal experience with glaucoma. You see, my mother and my brother were diagnosed with glaucoma. But let me tell you about my mother. When she arrived here from London, she was doing all right. Look, she told me she was all right. She's seeing everything. And she was cooking one day. And she asked me to give her a spoon. So I was giving her the spoon. But where I was giving her the spoon, she was not seeing the spoon. She was trying to take the spoon way below where I was giving her the spoon. So I told her, Mama, the spoon is not there. The spoon is up here. So I took her hands and brought it up to the spoon. So after she was finished what she was doing, I asked her to sit down. I said, Mom, cover this eye and look through the other eye and tell me what you see. And she said she could see me. She could see everything. I said, you can see everything in the room? She said, yes. I said, okay, let's try the other eye. Close the eye, the eye you could just see from, and open this other eye and tell me what you can see. And she's hesitating. I says, what can you see? She says, nothing. I says, nothing. I got in front of her. I says, can you see me? She says, just a little bit. Immediately I knew that there's a problem here. It's either glaucoma or it's a cataract. So we started to go to get an appointment for the doctor, the ophthalmologist. We went to the ophthalmologist, and the intraocular pressures were so high. They were above 21. Now the top measure for the eye, the intraocular pressure in the eye is 21. Anything above 21 is considered a problem. So we went she got eye drops and began to go to the doctor on regular intervals as was ordered. And then the pressures kept going up, and the eye got so bad that it was, the ophthalmologist told me it was going to affect the good eye, the high intraocular pressure. So then she had to have surgery, and that surgery is called a trabeculectomy. What they do, they drain the canal above the eye to see if it will lower the pressure in the eye. And that's what they did, and that helped a little bit. So she was able to keep some sight. Now, she didn't keep all of it, but she was able to keep some sight in the good eye until she passed away. But I'm saying this to you because please be aware, I knew nothing, and she did not know that she was not able to see from one eye. So you see how subtle the symptoms are. They're like no symptoms unless you check your eyes or you go to the doctor and get an eye examination at least once a year. If you go and there's a problem with the high pressure or anything like that, the doctor will start treating you, and your treatment will, your further follow-ups will be less than a year, maybe 6 months, 3 months, according to how difficult it is. So don't lose your sight. Try to visit your doctor. Try to keep your sight. Thank you.